Hi, I'm Dr. Ken Westrati with Orthopedic One. My specialty is shoulder and sports medicine. I did a fellowship in Los Angeles, California in 2002, really dedicated towards sports medicine, knee arthroscopy, hip arthroscopy, and as well as shoulder. So shoulder is something that I've had a real passion for, and I see and treat patients everywhere from young kids with shoulder problems with instability and dislocations to middle-aged people with rotator cuff problems to older patients with arthritis that require shoulder replacements. You know, we have multiple locations with Orthopedic One, and I see patients at 3 of the locations. Our Gahanna Taylor Station Road office, our office in the Polaris area, and then also in Powell. So today we're going to focus primarily on the rotator cuff. The rotator cuff, I've got a model. There's actually 4 rotator cuffs. There's 1, 2, 3, 4 rotator cuffs. And the idea and the purpose of the rotator cuff is actually to rotate the shoulder. So when these rotator cuffs rotate, or when they contract, they'll rotate the shoulder in. When the back rotator cuff contracts, the shoulder rotates externally. And when the top rotator cuff contracts, the shoulder goes up. You can see when this shoulder goes up this way, this rotator cuff tends to hit here. That's called impingement. And over time, that impingement could lead to tearing of this rotator cuff. Some of the symptoms that these patients will start to get, for example, if it's a patient's in their 60s and 70s, they'll say, well, for a couple of months, my shoulder's been bothering, and maybe I shoveled or I threw a ball for my dog, and then I've been having really a lot of pain when I raise my shoulder up. And that same patient will also describe, it bothers me at night. I can't roll over on it, or it wakes me up in the middle of the night, and I have a lot of night pain. And they'll describe pain that radiates down their arm. So the typical patient that we see with rotator cuff tears are usually in their 50s to 70s. Those are the patients that if they've been a laborer or a shoulder-dominant athlete in their younger years, their rotator cuff usually has more wear and tear. And so, you know, I tell patients all the time, the 60 or 70-year-old that comes in who has no history, and I say, well, I think you may have torn your rotator cuff, they're surprised that their rotator cuff may be torn because they weren't a baseball player. And a lot of people associate rotator cuff tears with baseball players. But when you get into your 60s and 70s, you really don't have to have any type of injury for this rotator cuff to be worn out because it's been rubbing on here for 60 or 70 years. Someone that's in their 40s or 50s, usually they have had some type of an accident. They were, you know, lifting weights and it shifted, or they fell off their bicycle, or they fell off of a ladder or a roof. So I usually tell patients, you know, the rotator cuff, the younger you are, the more trauma has to happen for it to tear. And so it's very uncommon for someone in their 20s and 30s to have a significant rotator cuff tear. And so it's really something that starts in our 40s with trauma, 50s with trauma, late 50s, 60s, and 70s. You really don't need to have much trauma at all to have a rotator cuff tear. So depending on how many of the rotator cuffs and how much of that rotator cuff is involved depends on the different treatment options. If someone has a bursitis, a tendonitis of the rotator cuff where it's just inflamed, that's oftentimes treated with physical therapy, maybe a cortisone injection to calm down the inflammation. Full thickness rotator cuff tears where the tendon is off the bone, now it's recommended that they should be fixed. And most times it's fixed arthroscopically. So it's outpatient surgery. We go in with a scope, we roughen up the bone, put little anchors in, and reattach the tendon back onto the bone because the rotator cuff won't grow back on by itself. And if you don't fix a full tear, the tears typically get bigger. If conservative options such as physical therapy have failed, or if someone has a high grade near full thickness or full thickness tear and you opt for surgery, it's a long recovery. I tell my patients to, you know, in their mind, they should think that this is a 6-month project. It's outpatient surgery to get it attached, but then you're typically wearing a sling for about 5 to 6 weeks. You're coming out of the sling to do some real gentle motion the day after surgery, but you're really not using the arm for any significant purpose for that first 5 weeks because that rotator cuff needs to grow back onto the bone. After 5 weeks or so, you're out of the sling, then you start going to physical therapy, and the therapist is going to work on motion and just getting the shoulder moving again because it's going to be stiff. And most experts agree that you probably shouldn't do much strengthening of a rotator cuff repair until you get to 12 weeks. So now you're already looking at 3 months before you're doing any type of strengthening of this shoulder. And so that's why it's really a 6-month project. 3 months of healing and range of motion, 3 months of strengthening, and that gets you to 6 months. And then the expectation after 6 months is that if all has gone well, patients have very little discomfort, they hopefully have full range of motion, and they've regained nearly 100% of their strength back.